So a breast reduction and a breast lift are very similar procedures. With a breast lift, obviously the breast tissue is being lifted and the nipple is being repositioned to a more youthful position. But usually in those cases, very little, if any, breast tissue is removed. Whereas with a breast reduction, we're also lifting the breast, but we're also decreasing the size of the breast. So the recovery for breast reduction and breast lift is pretty simple. When a breast reduction is done, often drains are placed, and for most patients, those drains are able to come out at the first post-operative visit, which is usually 1 week after surgery. I would say most patients are feeling great at that 1 week period. There are still some restrictions regarding activities for probably about another month. But patients are usually feeling back to themselves at about that 1 week mark. So there are 3 types of incisions that can be done for a breast lift and also breast reduction. For breast lift, sometimes we can do what's called a donut lift, where there's a circular incision just around the areola. That incision is probably used less often because it's most appropriate for patients who only require a small amount of lift. For more significant lifts, the incisions are usually either the lollipop or the anchor incision. Patients usually feel really great after breast lift and breast reduction, even after the breast lift, despite the fact that no or very little breast tissue is removed, because you don't have the pendulous weight of the breast hanging from the tissue. The breasts are supported and lifted, and in the case of a reduction, the weight of the breast is also decreased. So patients talk about feeling much better in terms of how they fit their clothes, less back pain, and just overall improvement in their quality of life.